Hi, in this recording, we're going to learn how to submit specimens to the InStride Lab, be that pathology, nail specimens, or cultures for PCR analysis. We're going to go over the workflow in ECW for submitting specimens. We've developed this workflow so everyone can submit their specimens in the same way, streamlining the way it works, minimizing the amount of information that needs to be taken out of ECW, keeping everything in to limit printing, scanning, filing, etc. In order to order your fungal stain specimens, your PCR specimens, or any other pathology specimens, we need to order them. It's done similarly for each of those types of specimens, and we'll take a look at each of them. By electronically creating this order, we get to provide documentation that the specimen was taken and sent to the lab. We have multiple people now involved, making sure the specimen is received, the results are obtained and returned, and then the physician can document that the review has or will happen. By closing this loop electronically as tightly as possible, we help to prevent any lab results from falling through the cracks. This workflow also minimizes printing and scanning, and nearly all the documents should be created in ECW, and only a minimum amount of paper is used to send with the specimen, and there are no documents to scan and file if you use the iPad for signing your form. And finally, the orders, the patient authorization, insurance information, and the test data are all electronic and available to everyone in the chain, reducing delays and eliminating phone calls. Once you've taken your specimen, you'll want to order your test. You can template these orders for a lot of different types of patients. So I will have picked my diagnosis. Let's say I use onychogryphosis. Of course, you could use onychomycosis, a perfectly reasonable diagnosis. And then I'll place my order. And pick a lab. And in this case, I want to do a fungal stain, which is one of my favorites, fungal stain. And it's added it to today's orders. And I can close this window, and I can close this window. So I've added my diagnosis and picked my order. By going back into the order, you can do a couple things. One, I click this box for collection date and time. The order can't be closed without having that collection date and time box checked. And if you check it when you make the order, which would be the same day that you take the sample, it'll be correct regardless of when the order finally does get closed. I also add an assign to by sending it to my assistant. And finally, if there are any notes I want to add with the order, I will add them here. Now that I've checked the collection date and time box, and I've added any notes that I want with the order, I'm going to reassign this order to my assistant, which I would do by entering the assistant's name right here. Once the lab order has been created, comments added, and sent to my assistant, patient's signature has been attained on the order, then the specimen needs to be reassigned to the lab. This is done by assigning it to lab, and you'll see the InStride Lab come up. And when you click OK, that order will disappear and show up at the lab where they will have it on their end, waiting for the specimen and ready to assign the results back to you. If we have a pathology specimen, like this patient that's presenting for excision of their probable verruca, we use a order for the pathology specimen. I have a template for this for a verruca. We'll have an excision of a verruca that's 0.6 to 1 centimeters. I add my template, and here I have my pathology specimen. This pathology specimen was associated with the verruca plantaris diagnosis. Just like with our fungal stain, I'm going to check the collection date, and then I'm going to assign it to my assistant. Once the assistant has finished packaging the specimen and having the patient sign their form, they'll assign it to the lab so that it can be sent, waiting for the arrival of the specimen and attaching of the report. This patient's returning for a follow-up of their ulceration. Seems like they've gotten worse, and we're going to take a culture to send to the lab for PCR testing. We're going to order it just like we do fungal nails and other pathology specimens. I'm going to go to my labs and I'm going to use my diabetic ulcer and cellulitis as the reason for my PCR test. I've ordered my PCR lab test. I'm going to do the same thing I've done with the fungal stains and with the pathology specimen, is check the date and time collected and then assign it to my assistant. Once the assistant has signed the paperwork and gathered the specimen, they'll print the paperwork and send it to the lab by assigning it to the lab. This will let them receive the specimen in the mail, perform the exam, and attach the results to the order. Once we've received our results from the lab, you'll get an item in your L jelly bean as well as in your D jelly bean. If we review the lab and the document in the D jelly bean, we can close both of those items at the same time. We'll navigate to the D jelly bean and open our results from our patient. And here we have the lab results, which I have previously signed by marking it up with the pen or adding some text, or sometimes I will add information here. Once I have marked up the document if I want, made any remarks, and then review the document and the lab, and that will remove both the document from our D jelly bean and the lab from our lab jelly bean. If you review the document in the lab, in the D jelly bean, both items are addressed.